past 20 years, scientists have pieced together a detailed understanding of celiac disease. They now know that it is an autoimmune disorder in which the immune system attacks the body's own tissues. This quote from Professor Alessio Fasano is part of his research paper, Surprises from Celiac Disease. I am credible to give this information because I've spent time researching celiac disease and include my resources in my speech. This topic is relevant to today because celiac disease is found commonly in the US and around the world. Despite the increase in availability of gluten-free products, many people still don't understand what celiac disease is. During my informative speech, I will explain celiac disease and its causes, symptoms, and treatments. Ben Harder defines celiac as an autoimmune disease caused by ingesting gluten from wheat or similar proteins in barley or rye. This means people with celiac can't digest bread, cereal, pasta, crackers, and many other foods, some of which you may not think contain gluten, like canned soup or certain drinks. Stark states, with celiac disease, the immune response causes inflammation that damages the finger-like projections called villi in the small intestines, decreasing the surface area, causing malabsorption, and giving a cobblestone appearance to the surface. This is the most major characteristic of celiac disease and explains the damage it can cause to the intestinal tract. Celiac disease differs from a food allergy or intolerance because it causes the body to attack its own tissues in response to gluten, as opposed to fighting an outside source. The immune response generated by celiac is caused by a combination of factors, which leads me to the causes of celiac disease. Paraphrased from Fasano, celiac disease is said to be caused by three factors: an environmental trigger, a genetic susceptibility, and an unusually permeable gut. The environmental trigger would be the gluten proteins from the food that the patients consume. Symptoms could also be triggered by changes in the microbiome of the intestinal tract, infections, and certain antibiotics, as paraphrased from Thomas. It is unlikely to develop celiac disease unless you have a genetic predisposition for it, like having someone in your family who also has it. That would make you more likely to develop it in the future. Genetic susceptibility is best described by Fasano in the Scientific American. 95% of people with CD possess the gene either for HLA-DQ2 or for HLA-DQ8, whereas just 30 to 40% of the general population have one of those versions. This finding and others suggest that the genes are not the sole cause of the immune hyperactivity, but that the disease nonetheless is nearly impossible to establish without one of them. This jumble of words and acronyms means that those genes are passed down from family member to family member, and unless someone possesses those genes, although many do, there are many other factors that would cause that, but without these two genes, you won't be susceptible to celiac disease. This also means that medical professionals can test patients for genetic susceptibility and make celiac easier to diagnose, because before it would just be based on symptoms, and those can vary a lot. Finally, patients with celiac disease also have intestinal membranes which allow more material to get through than with most other people. This allows the gluten proteins to reach white blood cells in the immune system and cause them to attack. Just as there are many causes of celiac disease, there are also many symptoms. Lebwohl states, celiac disease occurs in about 1% of the population worldwide, although most people with the condition are undiagnosed. It can cause a wide variety of symptoms, both intestinal and extra-intestinal, because it is a systematic autoimmune disease triggered by dietary gluten. The typical symptoms conveyed by several authors include digestive issues like bloating, diarrhea, and persistent indigestion. But sometimes no symptoms may occur until severe intestinal damage occurs. So right up here is kind of like a normal digestive system, and showing up here is the normal intestinal lining, and on the right side is the lining in a person with celiac disease. So as you can see, the gluten proteins are wearing down this top area and causing it, it's a lot harder to digest food in general when the finger-like projections, the villi, are worn down. And that's where all of these digestive system issues are coming from. If left untreated, celiac can also cause osteoporosis, malnutrition, joint pain, chronic fatigue, short stature, and dementia, and many other symptoms, which, as research continues and more people are diagnosed, they learn more and more every day. Now that I have covered a few symptoms, I will go over the treatments for celiac disease. As Liz states, the cornerstone of treatment for celiac disease is lifelong adherence to a strict gluten-free diet, which leads to improvements in clinical outcome, psychological well-being, and quality of life for most patients. But since adherence to a lifelong diet is incredibly challenging, the exploration of medication as a treatment for celiac in accompaniment with and optimistically replacement for the gluten-free diet is ongoing. Fasano and his researchers explain the exploration of medication to treat the three causes and hopefully prevent the disease from getting worse. They suggest drug therapies treating the specific proteins in gluten and the permeability of the small intestine in patients. With the advancement of current technology and medicine, it is hopeful that definitive treatment and prevention is on its way. This chart kind of outlines different drugs that they're researching and what it would prevent to try and treat celiac disease at the root causes, as opposed to just fixing the symptoms. In conclusion, celiac disease is an autoimmune disorder with many causes, symptoms, and future treatments. I hope that you now have a better understanding of what celiac is and its effect on many people worldwide. Thank you for listening to my speech.